Okay, well, now we're going to do around what we call the lateral canthus, what most refer to as the crow's feet. And this is a common area. And that really comes from squint real hard for me. Yeah, you see, is that from that movement, that's what makes you can relax that. That's what makes that line develop. And what we do, we prevent that from scrunching completely. One thing about that is, a lot of times is, can you smile for me? Big? Okay, yeah. Sometimes when people smile big, some of that comes from this muscle pushing up here. You cannot eradicate that. A lot of people say, well, you know, well, every time I smile, I get a little bit. You can't eradicate the whole thing, but there's a muscle around the eye. What you do is to soften that so it doesn't scrunch as hard. But you can't completely block all movement around the eye. And we're gonna put a little around here. Usually in a situation like this, I'm gonna do about 20 units around here. And what I do is kind of a little fan pattern around the eye is what I use. The needle for Botox is very fine. It's a 30 gauge needle, so this is not a painful procedure, but then it just softens. You get a little bit of puffiness right after the procedure, but that goes away. Even if somebody some people will swell a little more, but even so, I'd say within the next usually half hour, that usually goes away. And then what I always like to use is a little hyaluronic acid gel. And what that does, it just reduces the risk of bruising. Sometimes you have a little redness too from the injection, but same thing, that all those things go away. I say next 30 to 45 minutes that will resolve. Okay, now we'll go to the other side. Okay. Now we're going to do the crow's feet or medical or lateral canthus on the left side. Have you frown for me? Good. Or squint real hard? Yeah, so then we see that and smile for me. Yeah, and see how it really accentuates lines. And the one thing about it is when you smile, you push up something from the cheek. You can't eradicate that. But the lines, if you squint real hard, that's what makes it better. You can relax it. And same thing, I put a nice little fan pattern around the eyes. One thing, key thing with Botox is the needle is very small, so discomfort is usually very minimal. This is area of the skin because the skin is so thin around the eyes, can be more tender, but usually it's very well tolerated. Right afterwards, I'm going to put a little massage a little bit. I don't like it's not that somebody's do this at home. The thing I would try to have you do the next hour after the procedure is done is just to squint. About every 5 to 10 minutes you squint, because as you squint, that forces your body to take the Botox better. Put a little hyaluronic acid on.